Let's start with the topic, which is the acute viral meningitis. And in the first section of our topic, we will discuss the clinical manifestations, how the patient with viral meningitis will present. What's the etiology? What are different causes associated with the viral meningitis? And also we will talk about the epidemiology of viral meningitis. So the clinical manifestations associated with viral meningitis, we have it's common in patients who are immunocompromised. Patients whose immune system is compromised, whose immunity is suppressed, they are more prone to develop the viral meningitis. So, it's common in immunosuppressed patients. Then we also should know what are the meninges and what's meningitis. Meningitis is the inflammation of the meninges. Meninges are the coverings that covers the brain and the spinal cord. So it protects the brain and spinal cord, which are two very, very vital organs of the body, against different injuries and trauma. So when the infection reached those meninges, we have three meninges. We have pia mater, arachnoid mater, and dura mater. These are three meninges present. So if the infection reached these meninges, it can cause meningitis. So immunocompromised patients, they are more prone when they have less immunity. They cannot fight against the infection. Patient present with headache. Very, very common feature of meningitis is the headache, which is always invariably present. Fever, as with any infection, meningitis is also associated with fever. Signs of meningeal irritation, which is neck rigidity and all that, neck spasm, that's also very common in patients with meningitis. Coupled with inflammatory cerebrospinal fluid profile. So later on, when we will go over the different causes and presentations and examination, we will talk about what are different findings in the cerebrospinal fluid. Cerebrospinal fluid flows around the brain and spinal cord in the subarachnoid space. So any inflammation of the meninges is associated with some changes present in the cerebrospinal fluid. That's very significant and helpful in the diagnosis. Headache, again, is characterized as frontal or retroorbital. So when the meningeal headache is identified as the headache present in the forehead or retroorbital behind the eyes, that's the characteristic feature of the headache associated with the meningitis. It's also associated with photophobia. Patient does not like the light. Photophobia, fear of light. They want to stay in the dark, not in the light. Pain on moving the eyes is present because of the retroorbital pain. When the eyes are moved, patient has the pain on the movement of the eyes. So these are some characteristics of the headache associated with the meningitis. Knuckle rigidity. Knuckle rigidity is present in most cases of meningitis. It may be mild, present only near the limit of neck anti-flexion area. So anti-flexion area in the neck, there is knuckle rigidity present, which may be mild or in some cases can be moderate or severe. Next, some constitutional signs associated with meningitis. These are malaise and myalgia. Patient they have no energy, they have generalized body aches, that's myalgia, pain in the muscles, body, and they have no allergy, they have lack of energy. Anorexia, which is lack of appetite. Nausea, vomiting is also present, abdominal pain or diarrhea. So these are some constitutional symptoms associated with meningitis. So we have headache, knuckle rigidity, nausea, vomiting, abdominal pain, then we have malaise, myalgia. All these are the clinical manifestations of the meningitis. Some other features associated with the mild lethargy or drowsiness. Alteration in the level of consciousness can be present, stupor or coma. Mouth confusion, seizures or focal neurological signs, neuroimaging abnormalities, brain parenchymal involvement. So these are all the other features that may be associated with meningitis. Patient might present with seizures, they have seizures, they are not conscious, they have drowsiness, lethargy, coma, stupor. So all these are different features that might give the idea that patient might have meningitis, should be tested further for the diagnosis. Now, what are the causes of viral meningitis? We have some specific viral causes, specific causes that can lead to meningitis. Found in 60 to 90% of cases, important agents are the enteroviruses, ecoviruses, and Coxsackie virus, varicella-zoster virus, herpes simplex type 1 and 2, human immunodeficiency, HIV, arboviruses. Again, CSF cultures that gives us the which is positive in 30 to 70% of the cases. Frequency of isolation depends on specific viral agent. Almost 2/3 of culture negative cases of aseptic meningitis have specific viral etiology identified by CSF PCR testing. So we have some specific viral agents which are mostly associated with the viral meningitis, which are enteroviruses, Coxsackie virus, human immunodeficiency virus, herpes simplex type 1 and type 2. All these are different viruses that are commonly associated with the viral meningitis. But in some cases, there is negative culture associated even with specific viruses that can cause meningitis, and in those cases diagnosis can be made by the CSF polymerase chain testing. Viruses causing acute meningitis, common and less common, very good chart again. Common enteroviruses, varicella-zoster virus, herpes simplex type 2, Epstein-Barr virus, arthropod-borne viruses, and HIV. Next, less common, herpes simplex type 1, human herpes 6, cytomegalovirus, lymphocytic chorioretinitis virus, known as LC, MV, so lymphocytic choreo meningitis virus and mumps virus. So all these viruses can cause meningitis. Some are more common, some are less common, but it's not excluded that less common cannot cause meningitis. They can, but it's not as common as the viruses which are commonly associated with the meningitis. Next, epidemiology of viral meningitis, not nationally reportable disease. Incidence is 60,000 to 75,000 per year annually. Increased incidence in temperate climate. It increases in cases during no winter months. Seasonal predominance of enterovirus and arbovirus, and peak monthly incidence, 1 case per 100,000 population. So basically it's not very reported condition, about 60,000 to 70,000 every year. And some conditions, weathers also cause increase in the incidence, like temperate climates, and also some seasonal predominance can affect some different viruses. So that was all about the section 1. Thank you for watching sqadia.com.